We were going from doctor to doctor to doctor.
There was a pretty good chance that my daughter was going to die by the time she was 5.
He just turned to me, he said, "I really can't see."
I couldn't ignore it anymore.
Next, 2 medical mysteries that defied the experts. Haley DeQuara, a baby who was growing sicker every day. Could her doctors find the answers before it was too late?
It was more and more frustrating to me. There was always, it could be, or this is what it might be, but there was never anything that fixed it.
And Pastor Charlie Harper is a pillar of his community until a mysterious symptom turns this once outgoing man into a virtual shut-in.
It was scary. I didn't believe that I could ask other people for help.
On September 13th, 2002, baby Haley was born at 7 pounds, 7 ounces.
She looked pretty normal when she was born.
I thought she looked beautiful. It was my daughter, so she was perfect.
The first moment that I really knew something was wrong was, I would say, after her first night in the hospital with the breathing. She was just breathing very heavy, and she had a lot of congestion, and you could hear it in the back of her nose and her throat. She would snore. I mean, she was an infant, and she was snoring as loud as her father.
1997, however, is a difficult year as Charlie's work becomes more and more stressful. He seems to be getting more and more tired. Then, one day, something strange happens.
I began to experience starbursts or sparkles in my vision. They would look like a honeycomb of light, and then it would slowly dissipate. I had those flashes at least 2 or 3 times a month. I just thought that was just something normal when you were under a lot of stress.
At first, Charlie just tries to cope with occasional flashes in his eyes. In addition to the congestion, Kelly was struck by some of Haley's facial features, which seemed unusual.
Haley really didn't look like a normal newborn to me. Her eyes seemed too far apart for me, and her forehead seemed very high. It seemed almost rounded. I mean, it protruded out.
While we were in the hospital, she had taken her hearing test, newborn hearing screening, and she failed it.
The doctor came in and explained that she probably failed the test because of the congestion. I just felt like something was going on, and I just didn't know what it was.
But soon after, he notices another problem with his vision.
It became more difficult for me to read, and I was particularly noticing this in the pulpit. Number 1. More and more, I found my eyes glued to my text. My type size had gone up to 18, 20 points, enormous. And my congregation were getting a little worried when I would walk in with these stacks of paper that they were going to be in for a 4 to 5 hour lecture from the good reverend, but it was just large type that I was compensating with.
But with the exception of the hearing exam, Haley checked out okay, and the doctors sent her home the next morning.
We went for her 2-week checkup. She was growing fine, but she still had the congestion, and her pediatrician thought that maybe she had a cold.
I saw Haley since birth. During my physical examinations, other than the congestion when she came because of that, she was developing as a normal baby.
I was playing tennis with my father, who's 82, and a good friend of his who was also in his 80s, and I was missing every other ball. I couldn't focus on it, and I would completely whiff it as if I had a hole in my racket. And the 2 octogenarians ended up winning the tennis match. I could not believe it. I said, well, I guess this is just not my game anymore.
The first time I saw Haley was at her first baptism. I noticed that Haley's eyes were a little bit more further apart than most children. She almost had a Down syndrome look about her face.
When Haley was 3 weeks old, her congestion got worse. Then she developed a high fever. Alarmed, her parents rushed her to the emergency room.
They took a chest x-ray.
When Kelly saw the chest x-ray, she almost immediately noticed it wasn't right.
And we saw that her lungs were clear, but her rib cage was shaped almost like a pigeon's chest. She was very small at the top, and she widened out at the bottom. And I said, well, what's the matter with the shape of her chest? And they said, there's nothing wrong with the shape of her chest.
The doctors were assuring us that everything was okay. I'm a firm believer in doctors.
The x-rays showed no abnormality in Haley's lung development. Again, the doctors suspected she was simply fighting off a cold or flu and sent her home. But by the time she was 2 months old, Haley's breathing difficulties weren't the only problem.
Babies are normally very flexible. Haley just seemed stiff. Almost looked like she was wearing a neck brace.
You couldn't lift her arms up above shoulder height. I always felt like I was going to break her arms trying to put them in the t-shirts. And we were told that it was just, you know, she needs to just start stretching out a little bit and she'll do it in time.
She was getting fever a lot. She got many different ear infections.
Kelly was continually going to these doctors. You know, some people might think, oh, you're just grabbing, you just want something to be wrong with your baby, but I could tell in the tone of her voice it was just a true concern.
I started to think that, you know, Bobby thought that maybe I was just losing it a little bit.
I really didn't think there was anything seriously wrong. I just thought she had a lot of little things wrong.
Assuming he's simply getting too old to play, Charlie gives up tennis and takes up a new hobby in its place, painting.
My dad, he always loved art and loves to paint. He has a studio in the garage in his house in Arizona.
Despite her husband's faith, Kelly couldn't shake the feeling that something was seriously wrong with their daughter, and soon it became even harder to ignore.
When Haley was 3 months old, and I noticed that she had a curve in the base of her spine, and it became a little more prominent as the weeks went by. So we decided that we would take her to the orthopedist.
And he said there was a curvature of her spine. It wasn't normal, but not a major problem.
He showed us on the x-rays that he took that she had 2 misshapen vertebrae. It just wasn't one thing anymore. It was just, I was so afraid to go to another doctor because I was afraid every time we went, there was something new.
You know, we were bopping around. You know, we were going from doctor to doctor to doctor, pediatrician, the GI specialist, the ENT, the gastroenterologist, the orthopedic specialist, the cardiologist, emergency room visits.
Then, at 6 months, Haley developed another baffling symptom.
We noticed that, you know, with light, she would squint her eyes, you know. And if you took pictures, it would really, she would just squint a lot.
I always attributed that to taking after her father because I was always that way when I was younger.
But as time went by, I mean, it seemed to get worse.
I noticed that the light was bothering her. I noticed a little bit of tearing coming from Haley's eye. And there was like some haziness that I noticed in the eyes.
Dr. Gomez, who had known Haley since birth, suggested they take her to an eye doctor.
When we were going to the ophthalmologist, we really didn't feel that it was tied in any respect to, you know, what was going on previous to this. The ophthalmologist had noticed that there was clouding of the cornea.
So she said to us that, you know, it could be glaucoma.
When you hear glaucoma, it makes you think of people in the 70s, 80s, 90s. When you hear about a 7-month-old child having glaucoma, it just didn't sit right with me. Everything else I felt that she could grow out of. That was, I guess, my point where I felt that there was something wrong at that point, I guess, myself.
The test results were inconclusive, so the DeQuaras made appointments with more specialists. But it was during a routine visit with Dr. Gomez that they received some shocking news.
The doctor handed me a fax, and I looked at the page, and the first words that I saw were debilitating and fatal. And I said to him, well, what is this? And he said, well, the ophthalmologist faxed it over to me.
Haley's ophthalmologist had received a fax about a new drug trial for a progressive genetic disorder called Hurler syndrome. The description reminded her of the DeQuara baby, so she forwarded the information to Dr. Gomez.
He said, you know, she could have this. And I'm looking down the list of symptoms, and she had every symptom that was on there.
Patients with Hurler syndrome cannot produce an enzyme that breaks down sugar molecules. The buildup of those sugar molecules in the body can cause abnormal development in the heart, brain, and liver, as well as the eyes, bones, and ears. The disease is deadly and extremely rare, affecting only 1 in 100,000 people. Left untreated, children who are severely affected can die by the age of 5 or 6.
Kelly kept saying that she's got this. Everything that's on that page, she has.
I was not 100% sure that Haley has Hurler's disease. I told her, no, Mrs. Daquara, still we have to see the genetics doctor because we don't know now.
And I'm like, I don't think she's got it. I mean, the chances of her having it are so remote, I don't think that she's got it.
Charlie throws himself into his painting, but soon he finds that whatever is happening with his eyes is affecting him here as well. His daughter, Molly, is the first to notice.
One time she came into my studio and I was sharing my work with her, and it was a painting with very large strokes on it, and she said, well, this is great, but I'm wondering why you left this big white space here.
And I was like, did you mean to miss that spot? And he played it off as, oh God, I can't believe it. It's obvious, it's right there. How could I miss it? How could I miss it?
The next week, Kelly and Bobby took Haley to see a geneticist, Dr. Joyce Fox, an expert on Hurler syndrome.
I remember she was sitting in her mother's lap, reaching for toys and playing like any 8-month-old would play. But there were some subtle features about her that as a geneticist I was concerned about.
Those subtle features included Haley's facial appearance, corneal clouding, rounded back, and history of ear infections and congestion.
She examined Haley. She took blood and urine. But just the way she looked at her, the way she was examining her, I knew she thought she had it.
I was concerned that indeed she did have Hurler syndrome, but to wait until the results were in.
There was a pretty good chance that my daughter was going to die by the time she was 5.
The incident shakes Charlie up enough that he decides to get his eyes checked. But at the routine exam, he makes a startling discovery.
She puts up the letters up on the light screen. And of course, the first letter is this huge, 1 foot by 1 foot letter E. And she covers my left eye, and I look at it. I can't see that letter at all. I was in shock.
The Quaras were devastated when they learned that their daughter Haley might have a rare and deadly genetic disorder called Hurler syndrome. But they couldn't be certain until they got the results of her blood and urine tests.
Dr. Fox had called our house, and Kelly had answered the phone.
And I said, well, do you have the results? And she said, well, they came back positive. Haley has Hurler.
And immediately, Kelly melted and couldn't talk anymore.
So I said, okay, 1 minute. And I handed Bobby the phone. And I walked out of the room. Excuse me.
After getting off the phone with her, that's when it really hit me. And I started crying.
When I came back in, he was crying. I think that was one of the scariest points of all of this, because he is such an optimist, and to see him cry meant he knew something was wrong, and if he was crying, then it was real.
We just held each other and realized that now we know where we were going the last 8.5 months. Now everything makes sense. Now we have to figure out, what are we gonna do?
Because for 8 months, They were telling me there was nothing wrong with my baby. And then they told me she was gonna die.
Charlie Harper has been having eye difficulties off and on for the past few years, but has always chalked them up to stress and aging. Now, an eye exam is showing that he can't see out of his right eye at all. Panicked, Charlie makes an appointment with an ophthalmologist, but after examining him, the doctor is stumped.
He didn't know what it was. I thought, oh, well, then, if he doesn't know, then it's just, something we can't do anything about. I'll be fine. I'm just going through a change in my eyesight, and everything will adjust and stabilize any minute now.
There was no definitive cure for Hurler syndrome, but the DeQuarras soon learned of an experimental treatment at Duke University called a cord blood transplant. It could possibly stop the progress of the disease.
Well, when I first met Haley, she was about 10 and a half months old, and she really looked like a typical child of that age with Hurler syndrome.
Hurler is also called gargoylism. If the treatment didn't work, Haley would face a devastating future.
The disease was called gargoylism because the children looked like gargoyles. What would have happened is that she would have gradually shown more and more developmental delay. She would have had trouble walking if she ever walked. She would have lost vision and hearing. Her face would have gotten more abnormal. These children really become chronically ill until they usually go into heart failure and die.
The doctor recommends that he see a retinal specialist, but Charlie does not take him up on the offer.
That worried me, but again, I did not have a sense of urgency about going to see anybody right away. I buried it. I was procrastinating.
Charlie returns home, figuring that he'll muddle through on his own. But with each passing day, he finds himself gradually shutting down.
I would isolate myself. I started becoming depressed and anxious.
He was in denial. I mean, I think at that point, he was really suppressing his anxiety about what was going on here.
In a last-ditch effort to save baby Haley, Dr. Kurtzberg would attempt to transplant blood cells from a newborn baby's umbilical cord and placenta.
The transplant gives them a new factory of cells that can manufacture the enzyme that their body can't make.
10 days after they arrived at Duke, Haley was matched to a donor, but her troubles were far from over.
We were told that there was a good possibility that she could die going through the transplant.
But at the end of the day, when faced with one definite bad outcome and one that gave her the chance at having a good life, they felt like they had to take that chance.
Getting Haley ready for the transplant was a dangerous process in itself. She was treated with high-dose chemotherapy that destroyed her immune system and left her vulnerable to a fatal infection.
You hate like hell doing something like that to your child because you know that they're in for a lot of hurt. You know that it's either you do this or she's going to die.
But then, one night while driving, Charlie's eye problems take a turn for the worse, and he realizes that his condition is becoming more than just an inconvenience.
Looking out through my windshield was often like looking through sunglasses smeared with Vaseline. What would have been a fairly clear and straight road, it was difficult to see beyond 100 feet of the front end of my car. It was a little scary.
And try as he might, Charlie can no longer keep his troubles hidden from his family.
There was just that one time where I was, bugging him. I was like, Dad, what are you, an old lady? Come on, let's go a little above the speed limit. He just turned to me. He said, no, I can't, because I really can't see.
Eventually, Charlie hits rock bottom when he realizes he can barely function on his own. He turns to his big sister for help and tells her everything that's been going on. Jessica is floored. She has been having vision problems of her own, and they seem eerily similar to Charlie's.
A little alarm went off in my head because I had been through almost exactly the same thing when I was having vision problems. I was on a tennis court, and I remember the lines on the tennis court becoming distorted, so I'd see 2 lines instead of 1.
Jessica tells Charlie that he could be suffering from a serious condition. She recommends that he come to Los Angeles to see the doctor who's been treating her vision problems, UCLA eye specialist Dr. Stephen Schwartz. The next day, Charlie is on a plane to LA.
Charlie came in with a story of progressive visual loss, having been attributed to stress and other things in his life, which is unfortunately all too common of a misdiagnosis.
Dr. Schwartz goes over Charlie's medical history and then begins a thorough examination of Charlie's eyes. What he finds is alarming.
Charlie had evidence of previous retinal bleeding that had resolved spontaneously. So there was a footprint of some damage that had been there, almost like a high water mark.
Retinal bleeding occurs when the small blood vessels behind the retina become inflamed and rupture, often obscuring a person's central vision. Retinal bleeding could be a sign of a serious condition, including irreversible deterioration of the retina. Schwartz immediately orders a series of tests for Charlie. Within an hour, he has the results.
He had two findings that were very worrying. First, he had a finding called peau d'orange. Rather than having a perfectly clear and typical retinal exam, he had patches in the retina that looked like orange skin. He also had abnormalities in one layer of the eye, just beneath or deep to the wallpaper, deep to the retina, that looked very much like cracks. We call those angioid streaks. These two findings point us in a very definitive diagnostic direction. The answer was right there.
After 9 days of agonizing chemo, Haley, looking frailer than ever, was finally ready.
Haley's transplant day was August 1st, 2003. She was 11 months old. We put her in her pink dress. We all made a big day of it, and it was actually a really great day, and Haley slept through most of it.
It really is a very simple procedure where they basically just give her a blood transfusion, and that's the beginning of her new life.
The transplant was a success. Now all the DeQuaras could do was wait to see if it would work.
The worst possible scenario is that the transplant doesn't take.
During the stay down there, we saw a lot of kids pass away. It was just very scary to know that there was another child with her disorder and to see her not make it.
None of us even really called each other because you're almost afraid that you would jinx it. You just kind of wanted to wait for that phone call from Bobby and Kelly saying, you know what, everything went okay.
Schwartz calls Charlie into his office.
So I sat down with Charlie and told him that he had PXE.
Pseudoxanthoma elasticum, PXE, is a genetic disorder in which elastic tissue throughout the body begins to harden. In the eyes, hardening of the highly elastic membrane behind the retina can lead to cracking. Small blood vessels take advantage of these cracks and grow through the membrane. Sometimes these blood vessels leak and bleed.
Everything that was going on with my eyes, the need for stronger and stronger reading glasses, the inability to hit a ball, all my driving difficulties were directly related to PXE.
When the retinal bleeding stops, scarring may occur. If the scarring occurs in a person's central vision, it can cause blindness. In Charlie's case, the bleeding stopped just prior to doing any major damage to his central vision.
So Charlie asked me, am I going blind? And I told him no. Because if we catch this early and we start to give you these new medicines, you have every chance of not suffering the same effects that you would have untreated.
For Charlie, it was the rarity of PXE that made diagnosis so elusive, as only 1 in 100,000 people worldwide are reported to have the condition. It is also genetic, and both Charlie and his sister Jessica have been diagnosed with the disease. The two work with PXE International, a research and support organization, in the hopes of raising awareness for the disease. Charlie undergoes regular testing to monitor and treat retinal bleeding. And while there is no cure for the damage that has already been done, Charlie and his family are learning to deal with his partially impaired vision. Haley DeQuara was suffering from a rare and fatal disease known as Hurler. After watching their daughter go through a traumatic cord blood transplant, Kelly and Bobby could only wait to see if it would work.
They told us that her body was now making the enzyme that she wasn't making on her own before. So we knew that the transplant was working.
Haley was 100 days out, and she was healthy. You couldn't be happier that you went down with a child that was facing death, and you came back with a child that's facing life.
Haley was lucky to be diagnosed under a year of age because many children with Hurler are not diagnosed till they're older. So Haley had a better chance of really completely normalizing her life.
She's walking, she's babbling, she's babbling around the house. She really is such a beautiful, strong little girl.
We don't know what the future holds for her, but we believe that she will live a long, happy life.